Hello everyone, I am Dr. Kanchana Lakshmi Herbal Ayurveda Clinic, Panjagutta. Today in this video, we are going to discuss about cervical polyps and their management in Ayurveda. Cervical polyps are small, benign, finger-like projections from the cervix into the cervical canal. Cervix is the passage or in between the vagina and uterus. Cervical polyps are initially or mainly they are non-cancerous and they do not show any symptoms in many patients. In few patients, it might create some disturbances in the bleeding like irregular bleeding or heavy menstruation or bleeding in between the periods or bleeding after the menopause or after the sex immediately. In few conditions, these polyps might get infected or inflamed in infection conditions and they might create some purulent discharge. Cervical polyps are mainly two types, that is ectocervical and endocervical polyps. Ectocervical polyps mainly grow on the outermost layer of the cervix, whereas endocervical polyps they grow in the cervical canal. Mainly we see the polyps in 2 to 5% of women, mainly at the ages of 30 and in between 50. That too in mainly in perimenopause aged females and females with multi-grav. What causes this cervical polyps? Mainly chronic inflammation of the cervix or cervical canal, or sexually transmitted infections or bacterial or yeast infections mainly cause these cervical polyps. Coming to main symptoms or signs of this cervical polyps is first main thing is menorrhagia, that is heavy menstrual bleeding, and intermenstrual bleeding, that is bleeding between the periods and bleeding after the sex, and purulent or pus discharge seen through vagina. Coming to diagnosis of the cervical polyps, generally a pelvic exam or a pap smear test can be used to diagnose this cervical polyps. Sometimes ultrasound can be advised to the patient to see the tissues around the cervical polyp, and a biopsy of this cervical polyp tissue might determine whether this polyp is cancerous or not. This growth protruding from cervix is mainly explained in Ayurveda as yoni arshas. Many Ayurvedic texts like Sharaka, Sushruta, Vagbhata explained this yoni arshas in different contexts. Instead of giving symptomatic relief, Ayurveda mainly concentrates on curing this cervical polyp through roots. In Ayurveda, we give many therapies like Kshara Karma, that is introduction of or introducing alkali kind of medicine through vagina, Uttaravasti, that is introducing medicated oils through vagina, and cauterization, that is Agni Karma, where cauterization is done to the cervical polyp. These are all the probable treatments in cervical polyps in Ayurveda. We also give oral medications which act as anti-inflammatory and anti-infective drugs where they cure cervical polyps in many such patients. These Ayurvedic approach mainly concentrate on the cervical polyp disease because patients who are suffering or who don't want to go for surgery kind of things, they can opt for Ayurveda and go for only internal medications for this cervical polyp condition. If you liked our video, please subscribe our channel and share this video to your friends or relatives who are suffering with this cervical polyp conditions. For more information, please contact Care Herbs Ayurveda, Panjagutta. Thank you.